Now the next is about Kushtanidana. Athata Kushtanidana Vyakhyasyamaha Yathovata Bhagavan Dhanvantarihi. Now that word Kushta itself is often mistranslated. Kushta often is translated as leprosy, but it's not leprosy alone. It's about any of those diseases which produce a visible deformity. Kushnati vapuhu iti kushtam. So which give a visible deformity. Again, many times it's also translated as simply dermatological conditions. So it's not only dermatological conditions. Of course, majority of the dermatological conditions they come under the kushta. Leprosy also is a form of the kushta. Now, another of the controversy is about the Kshudra Roga and the Kushta. Kshudra Roga, many of the Kshudra Rogas, they are also referred to in the same context as that of the Kushta. So, the difference would be when a disease has become very significant and it has have a comparatively poorer prognosis, that could be considered as Kushta. When a similar disease has a better prognosis and comparatively easy to be treated, and the deformity is lesser, then the same could be considered as a Shudroga. More of that kind of controversy we will discuss when we go further into the topic as well. There should not be much confusion about these issues. Now, the etiology of Kushta is a Mithyahara Acharasya Visheshat Guru Virudha Asatmya Ajirna Hitashinah स्नेहपीतस्य वान्तस्य वा व्यायामग्राम्यधर्मसेविनः ग्राम्य आनूप उदकमांसानि वा पयसा अभीक्ष्णम् अश्नतो यो वा मज्जति अप्सु ऊष्मा अभितप्तः सहसा छर्दिं वा प्रतिहन्ति तस्य पित्तश्लेष्माणौ प्रकुपितौ परिगृह्य अनिलः प्रवृद्धः तिर्यकाः शिराः सम्प्रपद्य समुद्धूय बाह्यं मार्गं प्रति समन्ताद्विक्षिपति यत्र तत्र च दोषो विक्षिप्तो निश्चरति तत्र मण्डलानि प्रादुर्भवन्ति एवं समुत्पन्नः त्वचि दोषः तत्र तत्र परिवृद्धिं प्राप्य अप्रतिक्रियमाणो आभ्यन्तरं प्रतिपद्यते धातून् अभिदूषयन्. The causes could be due to mithyahara vihara and very specifically guru viruddha asatmya ajirna ahara. So food which cannot be digested properly or viruddha ahara. Among the viruddha ahara there is a specific reference of the matsya and the milk. Fish and the milk is one of those viruddha aharas which are well known to produce the kushta varieties, skin disorders to a great extent. Ajirna hitashinaha. Then another of the important is after the shodhana, if the samsadhana krama is not followed, and if a person does a uncontrolled or unwanted rigorous exercise, it could be like physical exercise or sexual indulgence, or the again very specifically mamsa and payas, the milk and the non-vegetarian food, gramya anupadaka mamsa and milk, they are considered again viruddhahara. Sushruta specifies again that point like gramya anupagudaka mamsa and payasa abhikshnam ashnatah. Repeated consumption of the milk with the other non-vegetarian fleshy food is also considered as a cause for the skin disease. Now, this is another area of controversy. At present, I think there are many non-vegetarian preparations where the flesh of animals is processed with the milk and then it's used as a regular diet. So, issue of whether this results in any skin disorder or not is another of the controversy. Then, majjati apsu ushma bhitattaha. If somebody cools himself immediately after exposing to high temperature, like when you go to the sunlight and then get exposed to the heat, and if you cool yourself by dipping in water, or the other way, getting into the air conditioned room when the outside temperature is very high, and if you go into air conditioned room where the temperature is regulated at a lower level, it could be resulting in the skin disorder. And this fact is almost studied, well known. A sudden change in the temperature of the surface of the body increases the susceptibility of the skin to skin disorders. There will be breakdown of the skin barrier, and it's now well known. So that's why now there are some guidelines about using that AC, particularly AC conditions related to the external temperature, and it's suggested that the difference in the temperature, gradient the temperature between the exterior and the interior of the AC should not be more than 6 degrees centigrade. If it is more than 6 degrees centigrade, it's now well known to induce a susceptibility to the skin disorder. This fact is studied and now it's being recommended that regulation of the temperature, so gradient of the your cooling of the AC should be maintained according to the external environmental temperature, and that should not be more than 6 degrees centigrade difference. This is the best recommendation. Of course, people may not practice it. That's the other way. Or sahasa chhartim va pratihanti, anti-emetics being given can be a cause for the kushta, a patient who has a tendency for vomiting, and if you suppress that vomiting by antiemetics, then it can be a cause for the kushta. This results in involvement of the pitta and kapha, and it vata also gets involved, and it moves around the body, reaches to the skin, and initially it produces the lesions over the skin. Later on, the disease will be spreading into the internal systems, deeper into the body. तत्र पूर्वरूपाणि त्वक्पारुष्यम् अकस्मात् रोमहर्षः कण्डुः स्वेदबाहुल्यम् अस्वेदनं वा अङ्गप्रदेशानां स्वापः क्षतविसर्पणम् असृज कृष्णता चेति. The tendency for these skin disorders can be categorized under three heads. The first is the appearance. The skin appearance of the skin would be changed. The surface characters of the skin, either the skin becomes rough or it becomes extremely smooth. The roughness of the skin is due to the increased keratin deposition, or it may become extremely smooth, or it could be the neurological changes, like neurological changes could be romaharsha or this swapaha, numbness, or romaharsha has becoming straight, and maybe altered sensation, or it could be resulted as the functional abnormalities where there could be either excess of sweating or no sweating. Itching also could be one of the complications, or it also can result in the infective complications where either there could be a formation of a lesion, ulcerative lesion, or a ulcer may not heal, non-healing ulcer, or it could be a blackish discoloration due to the stagnation of the blood, asudya krishnata. See, variations in the color, variation in the consistency, sensations abnormality, and functional abnormalities of the skin are the pururupa, prodromal symptoms of the kushta. Now, according to Sushruta, the kushta is categorized into Sapta Mahakustani, Ekadasha Kshudra Kustani. 7 are considered as Mahakusta and 11 are considered Kshudra Kusta. Evam Ashtadasha, total 18 kustas are varieties. 18 varieties of the kusta are mentioned, and those are Mahakustani, Aruna, Udumbara, Rishyajihva, Kapala, Kakanaka, Pundarika, Dhrudukustani. क्षुद्रकुष्ठान्यपि स्थूलारुष्कं महाकुष्ठं एककुष्ठं चर्मदलं विसर्पः परिसर्पः सिग्मं विचर्चिका किटिभं पामारकसा चेति. We will go into the detail of each of these. Now there is a slight confusion about the this number of the kushta and naming of the kushta as maha or kshudra kushta between Charaka and Sushruta. Charaka has mentioned Saptavidho, Ashtadashavidho, Aparisankhyavidho abhavati. The kushta could be either 7 types or Ashtadash 18 types or Aparisankhya. It could be innumerable. Now, the Sapta Mahakustas, the mentioned by Sushruta, by Charaka, are the तत्र वातादिषु त्रिषु प्रकृतिषु त्वगादींश्च तत्र प्रदूषयत्यासु वाते अधिकतरे कपालकुष्ठम् अभिनिवर्तते. Kapalakusta is one of that kusta, Mahakusta according to Charaka. Audumbara kusta is another one, and Mandala kusta is another one. Rishyajihva is another one, and Pundarika kusta is another one, and Sthula Arushka, Pundarika Sigma kusta is according to Sushruta is a Mahakusta, and Kakanaka also is a Mahakusta. Evam Sapta Vishesha Kusta Vishesha Bhavanti. Though Charaka has not used the word Mahakusta specifically, among the major kustas these are mentioned. Sigma, according to Charaka, it's under the major variety of the region, whereas according to Sushruta, it's in the Kshudra Kusta. Now, these differences, I think, would not be a matter of much controversy, should not be a matter of controversy. It's about the gradual evolution of the clinical approach. Sushruta has categorized based upon the evolved knowledge after Staraka. So there is a continuous progressive evolution about the knowledge of the disease and a progressive change in the perception of the disease. That's how it has to be understood, and it need not be considered as a controversy. And there is no need to have a bridging of the gap. Now in Chakrabarti commentary, there are a lot of comments about how to bridge this gap. I think that commentary and that kind of a discussion doesn't lead to anywhere. Hence, it's better to keep these as two separate entities and not an issue of controversy. Now, the Sushra again has categorized or presented about the clinical symptoms. Those symptoms could be Kushteshu, Tok Sankocha, Swapa, Sweda, Shofa, Veda, Kaunya, Soropaghataha, Vatena. When there is a vata vitiation, a common clinical symptoms due to the vata vitiation could be there could be contracture of the skin or numbness of the skin, swapa, or sweda, abnormalities of the sweating, or there could be interruptions of the surface of the skin, or it could even result in the deformities, or when it's involving further deep inside, saropaghataha, hoarseness of the voice also could be involved. Hoarseness of the voice is involved when the mucous membranes are involved. So it's not only the surface of the body, like skin alone, even the deeper tissues are involved, then it can result in the clinical symptoms of Sarvapagata, hoarseness of the voice. Now, for these symptoms to occur, if you look at the anatomy of the skin, it's mainly the keratin tissue there which gives you the external consistency. So, majority of the skin disorders which present with the abnormality of the keratin synthesis or keratin growth could be categorized as a Vata Vikusta. We will have more of that discussion later on as we go further in. And in addition to that, another of the major structural component is the nerve tissues, the nerve endings of the skin, which give you that different sensation of touch, sensation of pain, or sensation of pressure or vibrations. They are felt by the different types of the nerve endings, and abnormalities which affect these nerve endings also can be categorized as a vata deficit. So for the present, among the dermatological conditions which you see, those diseases which present with the involvement of the keratin tissue or involvement of the nerve endings may be categorized as Vata. Again, a bit of overlapping could be there, but to a certain extent it could be. Then Pakavadarana, Anguli Patana, Karna, Nasa Bhanga, Akshiraga, Sattva Utpattaya Pittena, when there is a pus formation or a wound formation or disruption of the keratin, this dissociation of the keratinized tissue like the nails, or even there could be necrosis of the tissue, or cartilages also could be involved, Karanasa Bhanga, or there could be maggot formation, Sattva. So infective disorders of the skin in general, that there could be pyogenic or not even vascular, which result in gangrenous changes. They could be categorized as a Pittaja. Then Kandu Varnabheda Shopa Asrava Gaurava Nishleshmana, when there is itching or when abnormalities of the discoloration, color as such, either blackish color or maybe the hyperpigmentation or absence of the pigmentation, hypopigmentation, or when there is a discharges, thick, serous discharges present, then it is our Gauravani, a heaviness or swelling local, could be the most of the allergic reactions, conditions which are produced with the allergy, immunological conditions, diseases of the immunology presented with over the skin, they can be categorized as Kaphaja Kushta based upon these issues. And to a great extent, this approach is true with a few exceptions, like keratin tissue, neurological conditions, Vataja, infective disorders, Pittaja, hypersensitivity and immunological conditions as Kapaja. This kind of an approach can be relatively practical. Of course, a few exceptions would be there. Now, from the presentation point of view, diseases of the skin are now presented, and we use the typical terms for the specific presentations of the disease lesions. Now, Shushra has mentioned about the tok parusha and the numbness and so on, or swellings. Now, the same are now described with the different terminology. When there is a lesion which is flat, which is not palpable, but locally there is a color change, that's considered as a macule, where the skin would be thicker, keratin tissue would become thick, And it's not the pigmentation abnormality, but because the keratin tissue itself has become dried up, that produces a pigmentation that's considered as macule. Probably it's a sign of vata. When the same has presented with the elevation of less than half a centimeter diameter, elevation at the size of less than half a centimeter, it could be again named as a papule. That's the usual terminology which we use in the present day situation, and that's a vata. That also could be considered as vata. Now, produced as vata. Then, when the lesion is relatively solid and it's more than half a centimeter, and it is involved deeper into the dermis layer, and hence the skin, that keratin tissue would show some wrinkles over the surface. That condition is called as the nodule, and it could be a sign of kapha. When the mass is larger than 1 centimeter, we use the term as tumor, and there it's considered as maybe a kapha. It could maybe considered as a kapha. Of course, you have all the other possibilities. Now, these are conditions where there may not be any signs of inflammation, non-inflammatory conditions. When the same is presented as a plaque where the keratin tissue has become dissociated and separated, flat and elevated surface with the and the keratin tissue has become separated, that's considered as vata. When there is a plaque-like condition, but which is reddish in color and produced with some sort of pitting edema due to the fluid around, and circular in shape, that's called as wheel, could be considered as kapha, which is often seen in hypersensitivity reactions. Whenever you do sensitivity test at that spot where you have injected sensitivity test, you will see that hyperemic changes, and that could be considered as wheel. Then vesicles are small blisters which contain fluid, and which is superficial, where you can see the fluid color through. That's the suggestion of involvement of a very superficial hyperdermis alone. It could be a considered as a pittaja, or when the same blister is bigger, larger, and greater than 1.5 centimeter, is often named as bulla. When the same contains pus purulent condition, it's the pustule. So the names which we now use are these names, and they may be suggestive of the pitta variety. Or then the lesions of the skin also are categorized as either primary or secondary. Primary lesions are where the lesions are produced as a result of the disease of the skin alone. When the same are produced as a result of some other complications, the manifestations of the skin are produced due to some other lesion, then they are called as secondary lesions, where the gradually the changes would occur. There, one group of the conditions are where the skin is either lost or there is a breakdown, and these could be erosions, ulcers, or fissures. Now, a fissure is when there is a small split in the epidermal layer, and you can see even the deeper planes of the skin, the dermis plane could be seen. That's called as a fissure, and it's very thin gap. When the gap is wider and there is a loss of skin in a relatively wider area, it's called as ulcer. When there is a loss of the epidermis alone in a wider area, but the dermis is still intact, it doesn't extend up to the dermis, then it's called as erosion. Now, these erosion, ulcer, and fissure, I will consider them as a tridosha, sanipathology, because there is a loss of the tissue. Then the other variations would be atrophy of the skin. Atrophy of the skin is where there is a reduction of the epidermal surface. It has become thin, and the skin looks like a very thin or somewhat transparent and maybe translucent and shiny, because the growth of the tissue is not proper, and the keratin tissue is thinner, though it may not be visible in an intact patient. Now, anatomically, diagrammatically, I can show you that, and you can make it up like, and that's considered as atrophy, atrophic dermatitis, and so on. You classify them. Then excoriation is where the loss of outer skin layers from scratching or rubbing. Now, due to a person who has itching and then so on, and there is a loss of the surface keratin tissue due to that physical irritation, that's called as excoriation, which I would consider as a variety of vata or kapha, vataja or vata kaphaja variety. And when there is a crust formation, where the discharges which are produced in the skin they tend to get hardened on the surface, and over the surface of the skin they are deposited. And once you remove that crust, there is a loss of the skin also. It can result in a superficial ulcer-like condition. That's called as crust, and maybe I would consider this as a Vata Kapha variety to a great extent. Of course, exceptions could be that when a similar area which doesn't result in a discharge but dried up, that's called as a scale, where there is a portion of the superficial layer of the skin, keratin tissue, and a part of the maybe a small part of the dermis also is lost. And when you scale up, there could be just the spots of bleeding, the bite or spots, as you see in case of the psoriasis. That kind of condition could be Vata Kapha, or the same could be waxy. The scale could be a waxy, scale could be either a hard, brittle, or waxy. So based upon that, we categorize waxy scales and maybe the brittle scales. And when it's quite brittle, hard, and the epidermis has become thickened, that the surface has become thick and rough, the same is called as lichenification. All these could be signs of Vata Kapha variety. A scar formed is a fibrous tissue formed after a previous lesion, when there is a breakdown of the skin, when it has become scar, or when the scar becomes hypertrophied, thicker, that's called as keloid. So these are categorized as the secondary lesions of the skin, which may be categorized as a Kaphaja Vyadhi. Now, coming to individual variety of the other clinical symptoms are Kandu Varnabheda Shofasrava Gauravani Shleshmana, due to the kapha, the discolorations produced. Any of these discolorations, like either hypopigmentation and or it could be the swelling, as in angioneuritic edema, they could be categorized as a Kaphaja Vyadhi, Kaphaja Lakshanas. Now, सर्वाणि कुष्ठानि सवातानि सपित्तानि सश्लेष्माणि सकृमीनि च भवन्ति उत्सनसस्तु दोषग्रहणम् अभिभवात्. Now, though these symptoms are mentioned as Vataja, Pittaja, Kaphaja, every Kushta Vyadhi would have involvement of all the doshas. So you will be naming those doshas based upon the predominance. That's exactly the point. So when I say Vataja, Kaphaja, Pittaja, Lakshanas, and categorize these primary and secondary skin lesions, this fact has to be kept in mind. Like when I say a macule is a Vataja, it's not that every patient presenting the macule could be Vataja. In some patients, it could be predominant. I'm just suggesting about the prevalence or maybe predominance of such conditions. तत्र वातेर अरुणं पित्तेन उदुम्बर ऋष्यजिह्व कपालकाकणकानि श्लेष्मणा पुण्डरीकं रुद्रकुष्ठं तेति तेषां महत्त्वं क्रियागुरुत्वम् उत्तरोत्तरं धातुनुप्रवेशात् असाध्यत्वं च. The Mahakushtas are the same Aruna, Udumbara, Rishijihva, Kapala, Kakanaka. Now what are these? तत्र वातेन अरुणाभानि तनूनि विसर्पिणि तोदभेद स्वापयुक्तानि अरुणानि. Aruna Kushta would be presenting with either reddish or blackish color, and the surface would be rough, and there could be toga bheda swapa, abnormalities of the sensations, mild alteration of the sensations. Either it could be pricking pain or numbness. Now, you can give hundreds of examples. Now, when I have given an example like acanthosis nigricans, it's not that acanthosis nigricans alone is Aruna Kushta. I'm suggesting about any of those diseases where there could be hyperkeratinization with a relatively numbed sensations not completely damaged. There could be many disease conditions. It's not only one. I'm just giving one example to show that every description which is mentioned in the Samhita can be recognized in the clinical practice. If at all you find a patient with this kind of a feature where there is a pigmentation usually in the skin folds and often produced as a result of maybe a previous contact. Again, acanthosis nigricans is not a final diagnosis. It could be produced due to multiple causes. Often it could be due to the sensitivity. It also could be due to the systemic pathology, like it can be a sign of malignancy. So there again, we have to go into that description. To conclude that every patient presenting with acanthosis is a Corona Kushta is also not correct. With all these reservations, I am suggesting about a possibility, like whenever you see a patient of acanthosis, it could be categorized as a Aruna Kushta. This fact has to be kept in mind. Now, as I told you, the acanthosis need not be a primary disease. It could be produced to multiple disorders. Syndromes of acanthosis nigricans, it can present with the either benign systemic lesions or malignant diseases. So it's important that every patient presenting with acanthosis, you have to go for the further diagnosis. Don't say that every patient is Aruna Kushta and then you treat accordingly. You need to go into the other possibilities. The possibilities could be hormonal changes like acromegaly, or it could be due to the vascular pathology, autoimmune disorder like telangiectasia, or then you have a plenty of syndromes of different sorts, Bartels, Barrel, Stevenson, and so on. It also could be a sign of encephalopathy, or it could be due to the hormonal changes again. Or more important, it's acanthosis could be a presentation of multiple cancers, systemic cancers. It could be a bile duct cancer, bladder cancer, breast cancer, colon cancer, so on, may present with acanthosis. So, main purpose of suggesting this could be, don't jump to the diagnosis of acanthosis nigricans patients as a Aruna Costa. It's quite important that you need to go into the possibility of other primary conditions. Then, if at all you are ruled out and then it's only the skin changes, then it could be considered as a Aruna Costa. Then the pittena pakka udumbara palakasi varnani, audumbarani, like udumbara pala. Now udumbara pala like appearance, a localized lesion which looks like a cherry fruit. Now we use the word cherry angioma for a hemangioma. It's a vascular, maybe congenital pathology, where the blood vessels have become dilated and relatively softer in condition. It's obviously the same. Sushruta has used the word udumbarapara, which is seen every day now, whereas in the current terminology, we use the word cherry fruit. Cherry fruit is not quite frequently seen in our area. Maybe it's a imported fruit, so western fruit. Otherwise, there is a lot of similarity in the appearance. So whether it's cherry or udumbara is not the point, it's about the appearance. A granuloma, pyogenic granuloma, when a chronic infective lesion which doesn't heal and there is a hypergranulation, that also could be considered as a udumbara kushta as such. Then the Rishidifa Prakashani, Kharani Rishidifadi, when there is a hyper thickening, hyperkeratosis, along with the keratin tissue being broken down, which we usually call as seborrheic changes. Seborrheic changes where the skin surface, dermis, as well as a part of epidermis, as well as a part of the dermis is involved, and the sweat glands also could be involved, and there could be hyperkeratinization, which tend to produce as multiple eruptions, which do not have much discharges. Very thick, very small quantities of the discharges could be presented, and they look like the tongue of these bears. Riksha is the bear. So tongue of the bears, which is rough and red. So that rough and red color could be the presentation. When of course the same becomes hardened and chronic, it may become blackish swelling, a seborrheic dermatitis. Again, seborrheic dermatitis also is not a single disease condition. Causes could be many. So every time you have a patient of seborrheic dermatitis, you need to go into the possible causes and then make out the diagnosis. Now, main purpose of showing this is just to show that the clinical description mentioned in the Samhita are seen practically. Then Krishna Kapalika Prakashani Kapala Kustani. Kapala Kusta are where the lesions become thick and look like a piece of pot, like very thick lesions, which we now use the term scleroderma. Scleroderma is sclerosis of the skin. The skin becomes hard, rough, and less flexible. Patient would not be having the flexibility. Now, and it's again scleroderma is often a autoimmune category, and the lesions are usually due to the systemic disorder. It's maybe it can result in more systemic involvement. A patient of scleroderma may have the systemic involvement. So evaluation from that point of view is necessary. It's not only dermatological condition. A chronic eczema also may present. Chronic eczema also may present with the very thickening over the area, particularly eczema which is having more irritabilities, where something is applied over and then there's a continuous friction that can result in the same. I would also consider them as the Kapala Kusta. Kapala is a piece of pot. देन् काकणन्तिकफलसदृशानि अतीव रक्तकृष्णानि काकणकानि तेषां चतुर्णामपि वोषचोषपरिदाहधूमयानानि क्षिप्रोत्थानप्रपातभेदित्वानि क्रिमिजन्म सामान्यानि लिङ्गानि. A strawberry hemangioma. Now, we use the term strawberry hemangioma and cherry hemangioma. Both of them are otherwise similar, but only the issue is about the presentation and the color. Cherry would be bigger and somewhat dark red, whereas strawberry is bright red color and size is smaller. That's all the difference. And strawberry hemangioma is where the size is smaller and it presents with reddish swellings. Or it also could be the similar issue can be seen in squamous cell carcinomas. Superficial squamous cell carcinoma, which may present with a small superficial ulcer and then induration. The difference will be in a hemangioma, there will be no induration, it will be softer, whereas a squamous cell carcinoma may have an induration and it can result in a ulcer formation, and then ulcer can result in necrosis. And all the cremigen or these, all the septic complications also can occur in that condition. So the kakanika is the fruit which we use generally for playing games, like so. That's the kakanaka phala, and gulugunji is a local word, and a lesion which has that appearance is a kakanaka. Then Shleshmana Pundarika Patra Prakashani Pundarikani. In the Kaphaja varieties, when the lesion has become relatively wider, flat, and the surface has become loss of pigment, slight loss of pigment, Pundarika Patravata, the surface is somewhat smooth or thinner, and then color also is gradually fading. Like that's the Kaphaja variety, which either is seen in pityriasis alba, that's what we generally call as this no, uh, that hypopigmentation patches which are seen uh, quite quite frequent one is a pityriasis alba, or a similar lesion also could be spots of hypopigmentation with the relatively thinner skin changes could also be a sign of early stage of leprosy. So whether it has to be considered as Pundaika Kusta or whether it has to be considered as Dhatugata Kusta, that part we will come to that later when we go into the Dhatugata Kustas again. But these can be made out as a Kapaja Kusta. और अतसी पुष्पवर्णानि ताम्राणि च विसर्पीनि पिटकावन्ति च दद्रुकुष्ठानि तयोः द्वयोरपि उत्सन्नता परिमण्डलता कण्डु चिरोत्थानत्वं च सामान्यानि रूपाणि. Now, in the Kapalya variety, the Pundarika or the Dadrukusta, in the Dadrukusta, the lesion would be Atasi Pushpa, slightly reddish in color, white and reddish in color, or Tamrani, or maybe red in color. And Visarpini, they tend to spread. There is a circumflexion or epicentric spread. The lesion in the central area would be healing. In the periphery, there will be the active lesion. And this kind of a spread is called as the pericentric, not epicentric, pericentric spread, which is a characteristic feature. And the term which we often use is ringworm because it has an appearance of ring. It's called as ringworm. And where there is itching is a major presentation, that could be considered as the other Dadru Kushta, common fungal infections of the skin. Then Shudra Kushta, the other Shudra Kushtas are the Sthulani Sandishu Atidarunani Sthularumshi, Sihu Katinani Arumshi, Pakpocha Bheda Swapananga Sadaha Kuste Mahat Purvite Bhavanti. Now, in case of the Shudra Kushta, the typical features will be there will be quite painful and deep-seated lesions which tend to have multiple ulcerative lesions, eruptions, and multiple openings, typically hidradenitis or actinomycosis-like conditions, where the patient often is presented in the axilla, inguinal area, and so on. And it, in due course of time, it results in contracture of the skin, or even the sensations could be altered. Tvakocha bheda swapananga sadaha. So it's the arumshi, the arushkara kushta is may be considered as the hydradenitis like conditions. Krishnarunam yena bhavet shariram tadek kustam pravadanti kustam. Eka kusta is where the surface of the body becomes blackish. There is a dark pigmentation, and dark pigmentation in the body could be again produced due to multiple conditions. Melasma is a metabolic pathology where there could be hypermelanosis or A drug pigmentation also can occur as a result of complications of systemic administration of the drugs. Many allergic reactions can also present with this darker pigmentation. The differences between a melasma is often in the exposed to the area. Drug-induced conditions could be anywhere. A dark pigmentation also can occur due to vascular stasis. So the lesions which are produced with the vascular stasis, dark pigmentation produced with the vascular stasis, I would consider this as the vataja. When the dark pigmentation produced due to hypermelanosis, increased melanin deposition, I would consider as a kaphaja. This is how we make it out. Then Shivyena contour Vedana Osha Kosha Kaleshu the Charmadalam Vidanti. Charmadala is where there could be more itching and then a crack in the surface. It's a hyperkeratotic lesion and it's also called as a hyperkeratotic dermatitis. Again, it can occur anywhere and often the causes could be many. Often it could be a contact, this irritation, but it could be systemic pathologies also can present in that condition. And these are considered as the Charmadala Kusta, one of the Kaphaja variety. All the point is you will see these conditions clinically, and if you make out like what is a Kaphaja variety and then plan the treatment, you will be successful in managing that. Then Visarpavatu Sarpati Sarpato Yaha Pagrattam Amsani Abhuya Shigram Murcha Vidaha Aratito the Pakan Krutwa Visarpas Sabhave Vikaraha. The word Visarpa is again misunderstood often. Visarpa is also categorized as a separate Vyadhi in the Vidhati and Visarpa. You have a separate issue. Visarpa is a variety of Kusta. Visarpa also is named in the Kshudraroga. Now, which are those Visarpas? How to differentiate? The description available in the text is comparatively lesser. So, what we consider is when there is a significant infective symptoms like acute cellulitis, it could be either a Visarpa, which is mentioned in the Vidradi variety, or the complications of the Vidradi, whereas a similar lesion with relatively minor clinical symptoms of inflammation could be considered as the Kushta. When very little or small area is involved, it could be the Kshudraroga. Maybe that could be one possible explanation. Of course, there is a controversy which is open for further discussion. I'll leave it at that point. But clinical presentation of a cellulitis where the patient may present with a widespread or rapid spreading lesion involving the Raktamamsa, reddish discoloration is produced, and it can present with the systemic complications of the infective pathology, Murcha, Vidaharati, etc. It could be considered as Visarpa, or Visarpa also could be so. It could be a single swelling which is extending, also could be a Sarpana which tends to spread rapidly, or multiple eruptions which tend to occur, vesicular eruptions which tend to occur and then tend to move around. It also could be the Visarpa. So, for more further about these issues, like when to consider, which of the considers Visarpa, we will have discussion when we go into the Visarpa Nidana and Visarpa Chikitsa later on. So, for the present, I will stop at that part. Like Visarpa could be of two varieties, multiple eruptions which tend to spread in a wider area, or a single lesion which has a tendency for spreading, extending as such. Both these could be considered Visarpa. Herpetiformis dermatitis also could be considered as a Visarpa. Then Shani Sharire Pidaka Sravandya Sarpandyastam Parisarpam Mahu. Parisarpa is a similar condition as that of the Visarpa, but the lesion is slowly spreading and comparatively firmer, discharges are lesser, and they tend to spread again slowly compared to the herpes. Now, certain variety of the herpes which tend to spread rapidly, whereas herpes simplex which is tend to spread, known to spread slowly, it could be the same, or it could be a variety of folliculitis, follicles, skin follicles inflamed and often produced to gram negative, gram positive organisms. It also can be considered as the parisarpa. Kandonitam shetam apayasigmam vidyartano prasha urtvakaye. The sigma is a hypopigmentation, loss of pigmentation, where the color could be blackish, a whitish color, and there is either it could be presented as the itching. When it is presented with the itching, often it is a complication of the tinea versicolor, in fungal infection, which is quite common, or it also may be presented with the hair loss at the spot and itching, and at times it can present without itching. But when it is presented with the itching, it's the sigma, and when it is presented without itching, it could be the kilasa. Kilasa again will come to that part later. राज्य अतिकण्डुवर्तिरुदः सरोक्षाः भवन्ति गात्रेषु विचर्चिकायां कण्डुमती दाहरुजोपपन्ना विपादिका पारगता इयमेव. The in the Vichastika, the characteristic feature would be Raji formation. Raji is the linear like, this line-like appearance, ruggeds can be formed. Now, that line-like appearance in a skin lesion is always suggestive of involvement of the dermis. Any condition which involves dermis, because the elastic tissues are present in the dermis layer, and if the dermis layer is affected, then it can result in a skin fold formation. The skin becomes inelastic, and that same also is named as elastolysis. We use the term elastolysis where the skin becomes lost, inelastic, which could be due to multiple causes. The same can occur due to multiple causes. Autoimmune disorders can present with elastolysis. Chronic eczema can present with the same. The infective lesions of the foot, like ruggeds, also can present with the same. But all of them can be considered as a Vichartika or Vipadika. Vichartika is when it is presented in the gatra, other parts of the body. A similar lesion where the skin folds are seen, there is a multiple rugged-like appearance, that's the Vipadika. Now, of course, we may categorize all of them as a subdermal pathologies of the skin. Then yatsavi ghanam vrittam ghanam ugrakandu tat snigdha krishnam kitibam vadanti. Kitiba kushta is where there are multiple openings and there are more of discharge and localized hard swelling. A localized hard swelling is very common in case of mycetoma, a fungal infection which involves the tissue and there are multiple openings. Or even similar lesion also can occur in tubercular lesions occasionally. A mycetoma also can present as intracranial lesion. It's not necessary that it could be present over the surface. That's all the important. When I say mycetoma, not that every mycetoma is a ketibakusta. A mycetoma can also present as intracranial lesion and then can present with the neurological symptoms, but they are not the ketibakusta. When the same is seen over the surface and then produces the interruptions of the skin surface, it could be considered as a the ketibakusta. Then Sasrava Kandu Parivahkabi Pama Anukabi Pirakabi Ushya Spotehi Sadahi Atisraiva Kachu Sip Pani Pada Prabhuvehi Nirupya. Kachu is another of the condition where there is a reference similar issue in the Kshudraroga also. That again we will come to that part. But typically the lesions are presented in the areas where the hygiene is not properly maintained, and small lesions present in itching, which is typically seen in scabies. Speak Panipada Prabhavehi, like in the buttocks or in the hands that tend to occur, and they are small lesions, which is very typical presentation of the scabies. Then Kandamritaya Pidaka Sharire Samsavahina Rakasa Uchyate sa. Rakasa is a similar lesion, but it's only the thing is it may spread everywhere, anywhere in the body, and the discharges are lesser, dry lesions. It could be like often it could be due to the drug eruptions, hypersensitivity reactions with the drug. Now this is a typical drug eruption produced due to sulfur drugs. Or it also could be a clinical sign of systemic malignancies like erythema multiforme. Erythema multiforme again is a manifestation of multiple systemic disorders, not necessarily a single disease, where localized erythema could occur and it could be a sign of systemic disorder which need to be investigated. Very often it could be a sign of a malignancy syndrome. अरुह ससिद्मं रगसाग महच्च यच्चैक पुष्टं कपजानि अमुनि वायो प्रकोपात् परिसर्पमेकं शेषाणि पित्त प्रभवाणि विद्यात एमं सुक्षित्र कुष्ठ अरुह कुष्ठ and sigma rakasa, these are considered as kapaja, and parisarpa is considered as pittaja as such. That's how it has to be differentiated. Right? Now, at the context of the kushta, Sushruta even refers to kilasa, a hypopigmentation which is also called as vitiligo. Now, the difference between the sigma and the kilasa is sigma is presented with itching, where there is a irritation of the skin, whereas the kilasa is not presented with the itching. That's the basic difference. Now, the Sushruta has categorized the kilasa into three categories: Vatena, Pittena, Shleshmanaja. Then Kushta kilasa yohantaram, the difference between the Kushta and the kilasa is Toggatameva kilasam aparishravija. in the when the kilasa the lesion is limited to the skin and doesn't produce the discharge, that's considered as a the kilasa. Tad vatena mandalam arunam parusham praidhamsita. When it is produced with vata, the lesions would be circular and slightly reddish and tendency for roughness. Pittena padma pratikasham saparidahanta. In case of the pitta, it could be reddish in color and there could be burning sensation. Shreshmana shvetam snigdam bahalam kandu mancha. It could be like huge, size could be huge and bright white color and maybe surface could be smooth. Sambandha mandalam ante jatam raktadom cha sadhyam agnidadham cha. Now, vitiligo, that loss of pigmentation, could occur with the due to many other conditions like the scar also. Sushil says they are sadhya. And when it is limited to a part of the body, focal, sambandha mandalam, it's limited to a area, or which is presented in the extremities, antejatam. This also considered as a sadhya. Now, in the presented situation, we categorize vitiligo into 5 types based upon their distribution. Scar and hyperpigmentation is not categorized as vitiligo, or it's not so. Translating kilasa as a vitiligo also is not very perfect issue. But anyway, from the present day's point of view, we categorize them as a focal, segmental, acrofacial, or vulgaris, or where it's spread irregularly, multiple, or universal, where the whole body is involved, and that's also called as albinism. Of course, it doesn't have much issue with the prognosis. It's only about suggesting about the deformity that this distribution is there. But according to Sushruta, this has something to do with the prognosis. Of course, more of that issue we'll go into when we go into the chikitsa. Then कुष्ठेषु त्वक् संकोच स्वाप स्वेद शोफ भेद कौण्य सोपघाताः वातेन पाकावतरण अंगुली पतन कन्नास बंध अक्षरोग सत्तोत्पत्तये कृतेन Kandu Varna Beza Shofa Srava Gauravani Shleshmana. We have referred to this shloka in the beginning. I have put that shloka in the beginning for the sake of making it convenient. So that in the beginning we have discussed, so it's not repeated. Tatra Adibala Pravuttam Pondarikam Kakanancha Asadhyam. A Adibala Pravutta, where there is a genetic tendency, and the Pundarika Kusta and Kakana Kusta are considered as Asadhya. Now, another important is a kusta or lesion which is linked to the skin initially can result in the other deeper tissues. It's a well-known issue. यथा वनस्पतिर्जातः प्राप्य कालप्रकर्षणम् अन्तर्भूमिं विगाहेत मूलैः वृष्टिविवर्जितैः एवं कुष्ठं समुत्पन्नं त्वचि कालप्रकर्षतः क्रमेण धातुं व्याप्नोति नरस्य अप्रतिकारिणः. A lesion of the skin can result in the systemic involvement, and you can quote many examples of this sort in the current situation. I have just put in the example of lupus erythematosus. Lupus erythematosus initially starts as a relatively superficial skin lesion, then gradually tends to spread in all the deeper tissues, and it may become incurable also, multi-systemic involvement in that. Even in case of leprosy, a similar presentation can occur. In the leprosy, the bacilli initially are limited to the surface of the skin, then go into the deeper tissue, and you may have systemic involvement where the multiple tissues like bones, cartilages also could be involved. So that kind of a extension of the lesion from the superficial to the deeper area is demonstrated in many disease conditions now, and the principle is the same. Like if they are not treated properly at every stage, it can result in the next stage, and hence the treatment has to be done at a proper time. That's the point which Sushila has highlighted. Now, from the point of view of leprosy again, I have just categorized in the present day situation. When you go into the classification of the leprosy, there again you have exactly a similar issue based upon the surface, involvement of the surface and the number of the lesion. That extent of the lesion is categorized into either these typical, where the lesion is localized to one area, or it's spread as it, depending upon the factors like number of lesion, size of the lesion, and the surface characters, and when there is a sensation present or not. That's how we clinically identify these conditions. So, in case of the kushta, if you consider this as the leprosy asset, and if it is about the leprosy which can result in the tissue loss, the categorization is done with a typical classification methods, and of course, classification now are based upon the Ridley classification or WHO classification. Now, all these are relevant when you go into the further discussion of what we consider as Sushruta about the Dhatugata. Now, Sushruta has given a description of Dhatugata Kushta. That Dhatugata Kushta is about maybe very much relevant in case of the leprosy, or it also similar description can be seen in the SLE, lupus erythematosus. Now, my purpose of referring to this classification which is done now is to highlight the difference between the current approach and Sushruda's approach. Current approach is this based upon the presentation, typical clinical presentation or presentation of the this microbiological test positivity or negativity. So leprosy is categorized as tubercular or borderline with the borderline again BB or borderline lepromatous or lepromatous leprosy depending upon the depth as such. Now, Sushruda's categorization is more practical. Now, when the lesions are limited to the skin alone, then the Tvaggata, Spashahanihi Svedratvam Misha Kandushjayate, Vairanyam Rukshbhavascha Puste, Pachisamashite, lesions limited to the skin are presented with the hypopigmented patches which may look rough and there could be slight variation in the sensation and itching. When the same is involving the deeper tissue, त्वक् स्वापः रोमहर्षश्च स्वेदस्य अभिप्रवर्तनं कण्डूः विपूयकश्चैव कुष्ठे शोणितसंस्थिते. When it's involving the blood or shonita, no, I will not say blood, the deeper tissue, the presentation could be like there could be a loss of sensation and the abnormalities of the sweating, itching and pus formation also can occur. Now, we use the term erythema nodosum as the clinical presentation of the leprosy there in that condition where the lesions would be. On that point is a patient of, if you see, look at the patients of leprosy, you can identify these stages, Tvagata or Raktagata as such. Or when the same is involving the deeper area, further, Sushil says the Mamsa Samashita. Now, whether Mamsa is muscle or it's not the point. The point is about one level ahead. The lesion in that condition, Bahulyam Mokta Shoshasta, Karkashyam Pedakodgamha, when there are localized eruptive lesions, which also can present with the discharges, Todaha, Spotaha, Sthiratomja, Kuste, Mamsasamashite, when there is a induration, which is called as a insensate patch, where there is a patch and then there are eruptions. This also is a presentation of the leprosy. Or when the same goes further deeper, Daurganyam Upadehascha Puyo Atha Krimestara Gatranam Bhedanam Chapi Kuste Meda Samashite, when it is involving the Medo Dhatu, again going into that controversy like Medas is fat or muscle, it's not the point here. The point is about a further deeper plane of leprosy lesion which can be seen. So the classification of the leprosy lesions based upon Sushruda's principle, they can be demonstrated clinically, whereas the present day's classification is having a different approach. That's all the point. The approach is different. Otherwise, the purpose is the same. When there is a foul-smelling gangrenous lesion or even a maggot formation, that's considered as Medasamashita. Then when still it's involved as astimajja, it can result in nasabhangaha, akshiragascha, kshateja krimisambhavaha, bhavet sarupaghatascha, astimajja samashite. When there is astimajja involvement, the cartilaginous destruction could be seen, which results in the deformity. So all these these conditions can be demonstrated clinically. Then Kaunyam Gatikshaya Anganam Sambheda Kshatarpanam Shukrasthanagate Lingam Prabhuktani Tachayota. Even Shukragata Vyadi clinical presentation can be seen, where there would be a deformity, a visible deformity, and movement could be lost, and there could be even the Kshatasarpanam, the wound tends to become chronic. It could be involved in, presented with the significant deformities. Then the only one issue which is not this highlight or may not be substantiated with the present day's context is स्त्री पुंसयोः कुष्ठदोषात् दुष्टशोणितशुक्लयोः यदपत्यं तयोर्जातं ज्ञेयं तदपि कुष्ठितं. Sushruta, according to Sushruta, Kushta Vyadhi is transmissible from a parent to the child. But as per the present day's knowledge, this is not proved, this is not substantiated. Rather, people say that it cannot be, it may not be. So that's the point. Again, as far as the current knowledge is concerned, this may not be true. Now, whether it can be, still there is a possibility or not, that kind of a discussion is not our target, so we leave it as such. So, Sushruta's perception could was something different. Maybe that you may see the leprosy in the families, reason could be the later contact, may not be transmission through the genetics, whereas the word meaning suggests about a genetic transmission, that's all the point, so we'll leave it as such. Now, a similar issue of that Togata or the talk to the deeper lane also can be demonstrated in a SLE. Now, the same point in the SLE, the typical description would be or categorization of the SLE would be seen when you have cutaneous domain, then arthritis domain, neurological domain, serositis domain, or hematological domain, or renal domain. The sequence of these events may be different, which again suggests about the severity of the SLE. The scoring system is the same. Of course, more of that discussion, maybe more detailed discussion may have when we discuss about the SLE later on, maybe in some other context. So for the present, my purpose of showing this is that kind of an approach of predicting the course of the disease and predicting maybe the outcome of the disease based upon the plane of the tissue is present even now, whereas in Switzerland's period, the similar was a common issue. Then Kustam Atmata Sadhyam Dograta Pishashram Medogatam Bhavedyapim Asadhyam Atautaram. Prognosis can be better if it is in the superficial plane like Pag Rakta Pishda, skin and the blood, Rakta and the Mamsa. Medogatam Bhavedyapim. Further, it's Asadhya. Now, another of the controversy is among the causes of the Kushta Sushada said, Brahmastri Sajjana Vadha Paraswa Haranadivi Karmevi Paparodasya Prahu Kustasya Sambhavam due to the sin of criticizing elders or harming females or maybe Sajjanavadha, harming good people or theft, these can be a cause for the Kusta controversy, whether it is justified or not. If at all the same is true, almost 99% of the population should have the Kusta. म्रियते यदि कुष्ठेन पुनर्जातेऽपि गच्छति नाटक कष्टकरो रोगो यथा कुष्ठं प्रकीर्तितम्. Another of the controversies, according to Swift, if a person dies due to the kusta, in the next birth also he may have the kusta. Now again, from the current point of view, there is no question of justification or maybe finding some evidence of that sort because Punarjanma is not accepted. So we'll leave it as such. We will not comment like whether it is true, false or so on. Just a perception of Sushruta. Ahar acharyo proktam asthaya mahatim priyam औषधीनां विशिष्टानां तपसश्च निषेवणात् यस्तेन मुच्यते जंशु सपुण्यां गतिम् आप्नुयात्. The prognosis is poor and the treatment is difficult. You have to follow very rigid this guideline and the medicines also have to be taken and you have to be very rigidly adapted to the treatment. Then only it's possible that you may have a cure of the kusta. Then the last part is social efforts about possible contamination of the kusta and at the same time other diseases which also can be transmitted from one to the other due to the physical contact could be prasangata, gatra samsprashata, nishvasata, saha bhojanata, saha shayyasanat chapi, vastram ajyanulepanata. The causes of communication of the diseases, which is very popular and which is a very standard protocol of a possible communication source, which could be due to the physical contact or could be dissemination through the spread this air which is breathed out or breathed as such. Now, Kushtam Jwarascha Shoshashcha Netrabhishandevata Upasargika Roga. Such diseases are called as Upasargika Roga and Kushta is one of them. That's about the Kushtanidana. With this, we'll conclude today. It is Sushruta Samhidam Nidanasthane Kushtanidanam Nam Panchamodhyayaha. We'll conclude today. If there are any questions, we'll try to answer and then there are few questions like lichen planus comes under which type? Now, I am not saying lichen planus. Lichenification is a sign of Kapaja Vyadi, Kapaja Lakshanas. So, any condition where there is a lichenification of the tissue, lichenification is a hardening and thickening of the epidermal tissue, is can be considered as a Kapadrushti. Lichen planus obviously is a Kapaja Kusta. Then under which type of skin disease erysipelas can be considered. Erysipelas is of course a visarpa, paisarpa or visarpa in that condition because it can be categorized as the Pittaja variety. That's the clinical presentation of that. Right. These are the two questions. We'll conclude today. Okay, thank you.